That we are prepared for flu season. The Big Apple's top doctor, he's here with us this morning.
Yeah, welcome the Commissioner of New York City's Department of Health and Mental Hygiene, Dr. Dave Chokshi. Good morning to you, Doctor and Commissioner. How you doing?
I'm doing well. Good morning. Thanks for having me on such an important topic.
This is such an important topic. Everybody has questions about this every single year, right? So on your website, actually, on the Health Department website, it says this year's flu vaccine could be the most important one you ever get. Is that because this age of coronavirus we're in?
That's right. We are saying this year could be the most important flu shot you'll ever get. It's because of COVID-19. It's because we've seen, how much New Yorkers have done to protect one another as well. We take the flu seriously in any year, in any season, because it is a preventable illness. It's something that causes suffering and can also cause deaths, particularly among the most vulnerable New Yorkers. So
well, I think that's really important.
So we're strongly encouraging everyone to get the flu vaccine.
Commissioner, you brought up a very good point. The flu kills people every year, tens of thousands, in fact. I see you got your flu shot button there, so you have gotten your shot. Dan got his the day before yesterday, right?
Yes, 2 days ago.
So some folks are worried and wondering, because there's always that debate, when should you get the shot? Is it too early now? Should you wait till a little bit later in the season? Does the shot change? Do the strains change? Give us the update on what we should do.
It's a very important question. The shot does not change. The strains that are in the vaccine do not change. And the bottom line is this: now is the right time to get the flu vaccine. You can get it today. You can get it next week. When you find time to get it, right now is the best time to get it, because it gives you protection over the entire flu season.
Right, so it won't, because some people were saying, oh, it's only a couple months that it keeps you safe.
No, that's not true. The immunity lasts for longer than that, so now is the right time to get it.
So what exactly is in the flu vaccine? I know it might sound like a loaded question here, but, because we understand that the strands change every year that they're injecting into you, and some people are like, well, I don't want to get the flu shot because I get sick from it.
Yeah, these are also very important questions. The influenza vaccine, really there are a few different types of the vaccine for children, for older adults, but all of the vaccines have this in common. They contain parts of the virus that will not infect you. They'll only give you immunity to influenza. And they're based on the strains that are most likely to be circulating in any given season. And so the important points are these. Number one, you're not going to get sick from getting a flu shot. You might get a bit of soreness. You might get a bit of a reaction at the place where you got the shot. Yeah. But these are, in almost all cases, very mild. And they last only for about 24 hours. So it is completely safe. And we know the flu vaccine is effective as well.
Commissioner, I know some folks may be yelling at the screen right now going, wait a second, no. Every time I get it, I do feel sick. And I'm one of those. And I don't know if it's a mental thing or not, but I feel like I get a little bit of a cold. I feel a little under the weather after getting the shot. But you say that that's not the case. So why do people feel that way then?
Well, some of that feeling of being a bit under the weather, feeling like maybe you're fighting something off almost, that's actually your immune system revving up. And that's what you want the vaccine to be able to do.
Okay.
But in terms of an illness, something where you feel much more severely ill, that does not happen as a result of the flu
So let me ask you
vaccine.
this, because the symptoms of the flu and the symptoms of COVID-19 are very similar.
Yes.
So heading into the season, how does a person know, even if you have the flu shot, what are you recommending in terms of the symptoms here and getting tested, because the symptoms are so similar?
Right, because someone may think they have the flu and not go get tested, but then they have coronavirus, and that could be really dangerous.
Right. Well, let me start with this very important point. This is one of the reasons that we're saying the flu shot this year is the most important one you might ever get, because it gives us a chance to keep people from getting the flu in the first place. We can prevent these situations where it may be difficult to tell whether someone has COVID-19 or the flu. So that's one of the most important reasons to get it. But to get to your question itself, yes, that is true. Some of the symptoms of the flu and the coronavirus are similar, particularly fever, cough, sometimes shortness of breath as well. And so what you should do if you're feeling that and you're not feeling well is you should go to see a doctor. They will test you for COVID-19. And as we get further into flu season, they're likely to test you for the flu as well.
Commissioner, we're out of time here, but I want to squeeze in one more question here, and it involves schools, because the New York City Health Department, we understand, is working very closely with the Department of Education on how to safely send children back to school. We're seeing dozens of cases already with staff members prior to kids even going back. So what should parents know heading into the school year?
Parents should know that we are working around the clock to build multiple layers of safety for children as well as staff in the school setting. This has to do with testing to make sure that people who are infected, who are positive, know to stay home and not come to school, but also so many things that we're doing in the school building itself, making sure people are wearing masks and face coverings, making sure that things are cleaned and disinfected, making sure that people are keeping their distance. So it's a full court press to ensure a safe and healthy school
But should
reopening.
they be prepared for their child possibly getting it, even if we're seeing staff members have it before kids even go back?
Well, certainly as a doctor, I hope that as few people as possible get it, and all of those precautions that we're taking will minimize the number of cases in schools. But we should all be prepared for some cases to emerge over the next days and weeks. Although New York City is at a very low level of COVID spread in our community, it's not zero.
It almost seems inevitable.
So we all have to acclimate ourselves to the fact that there may be some cases, but importantly, we'll identify them quickly and isolate them, make sure that they're not spreading it to others.
All right, Commissioner, thank you so much for your time. We appreciate everybody. Get your flu shot so we can get a button like what you're wearing today. You got to get one of those buttons, right?
I can get one.
Thanks for highlighting it.
Absolutely.
So simple advice. Get your flu shot. Thank you.
Can you mail me one, please?
Take care.